Good evening, everyone. We'll just wait for a couple of more minutes before we start. Hello. Thank you for joining. We'll just wait for one more minute before we start. So let's just wait till 7:34 and then we will start with today's topic, which is first trimester. And it's going to be a short one, but I wanted to touch base on some important pointers which should be kept in mind when somebody is in their first trimester, because the effect is not only limited to first trimester, the effect basically passes on even after birth. So the prenatal actually has an impact on the postnatal too. So keeping that in mind, this entire month we have first trimester, second trimester and third trimester. So these 3 trimesters are very important, and each trimester will have some different parts of the body of the child that gets developed. And at that particular time, if some kind of infection happens, then that child can have certain kind of disabilities with which they can be born. So all of that we are going to discuss throughout the month in 3 different lives. So today's life is all about first trimester. So what is a trimester? As everybody knows, most of us knows that trimester means the first 3 months. So first trimester basically means the first 3 months, and then similarly we have second trimester and third trimester. So the first trimester starts from the last day of the menstruation and it continues till the 12th week. So that's the period of first trimester. We all know that usually every month has 4 weeks. So 12 weeks means 3 months, but it starts from the last day, or like the last day of the period. So last period. So which means that when somebody actually gets to know that they are pregnant or they have conceived, they are usually 5 to 6 weeks pregnant. So that's when they get to know. So it doesn't happen that you conceive and you get to know within 7 days. So it doesn't happen like that. It usually takes that much of time for your, for you to understand that you have conceived. So there are 2 particular periods in the entire first trimester, can be divided into 2 groups. The first is called the period of the zygote and the second one is called the period of the embryo. So what is zygote? Zygote, this is like going back to biology classes. Zygote is basically when the sperms meet your egg cells, then the zygote is formed. Now when the zygote is formed, it's basically, it has 46 chromosomes. So we all know what chromosomes are by now. So 46 chromosome means 23 from your mother and 23 from the father. So equally, these characteristic traits are going into the child. Now it does not mean that the child has only this much of characteristics. It also means that apart from this 46 chromosomes, this is the nature of the child. Like there will be traits which are similar to father as well as similar to mother. Which traits? Of course, none of us have any control over that which 23 chromosomes contains what kind of traits. But the other part of the child's personality is built up from the nurture, the environment or the family, what happens during the entire pregnancy, everything. Now why I'm constantly being harping on the what happens during the entire pregnancy period? Because the child, for example, the environment or the world of the child is the mother's womb. Now the mother is in the outer world. So basically the impact that the world has on the mother, that impacts the child inside of the mother. That includes nutrition, that includes the environment, that includes a relationship with other people, that includes any kind of anxiety, stress, anything. So if the mother is constantly stressed or constantly irritated throughout the pregnancy period, that kind of impacts the child Like the child is born with a very unstable personality, the child tends to have very dependent personality, or the child tends to have genetically some kind of stress issues. So that's why it is very important to understand that being pregnant is not a matter of joke. Like, it's just a matter of one night that you can conceive, but then as a woman it is our responsibility to hold the child for 9 months in our womb. So the womb in which the child is there, that is their world. But as a mother, I am also in the outer physical world. So whatever is happening to me, that definitely releases some kind of chemicals, hormones, which affects the child which is still growing. In fact, that also affects the child's growth of different organs. Similarly, like, many child who are autistic, so I got my stress issues from my mom. Not necessarily, Jayashri, not necessarily, but there can be, there can be a possibility. As I said, that 23 chromosomes from your mother, 23 chromosomes from your father is a part of your genetic build-up. So some traits will be common, whether you like it or not. I have seen many trauma patients, they share genetic traits with the person who have been the perpetrator. Like, let's say for me or for anybody else, the perpetrator was the father, so because of whom I am currently in trauma. Now I have also picked up certain traits subconsciously within me, and those traits are also kind of revolving around the decisions that I make. So that's why it is not only about prenatal or during the pregnancy period. Everything that is happening, that develop or that impacts the growth of the child, that also impacts what is going to happen to the child after they are born, and also impacts the personality of the child. Okay, so this is the main gist of why I wanted to talk about trimester suddenly in a mental health page. So now from the period of second, like this is the period of your zygote, where the 23 chromosomes are gone, and then the zygote is formed. Then the zygote is broken into two different cells, and then they keep on multiplying into different cells until 9 months. So basically there is one cell, unicellular, then it is broken into two cells within 2 weeks, and then it keeps on multiplying into various cells, and like this entire human being is formed inside of a mother's body. Okay, and then comes the period of the embryo. The period of the embryo is from the second week till the end of second lunar month, so almost like third, the end of first trimester. So I want to talk about the what are the developments that usually happen. So I have jotted down certain pointers that I will be talking about. Like, first, what develops inside the mother in the first trimester? Why is it called so crucial? Why it is like the first trimester and the last trimester is the most important part of any pregnancy? There are reasons for that, because of the organs that develops during this period. Okay, so uh, during the period of zygote, so what happens is that from the 15th day of conception, that is the second week of conception, it continues, the multiplication of cells continues inside the body. So at this time, at this particular time of tissue differentiation that keeps on happening inside the body of the child, they are susceptible to various virus, not fever, but several bacterial infections or viral infections. So at that time, what we call them are the teratogens. So yeah, it's a little tongue twister. It is called teratogens, like rubella and the likes. So that's why mothers are given a lot of injections at the beginning of the trimester. They are given rubella injection, they are given this and that, because when you're constantly, especially when you go for x-ray or any kind of ultrasonography, the chances of you getting contaminated or infected is much higher through radiation. That's why mothers are given different kind of injections at the very beginning, so that the child is protected from such kind of teratogenic attacks. Okay, now, if the child has any kind of developmental issue, what is developmental issue? Autism, learning disability, mental retardation, any kind of what we call the so-called special needs child, he can have the issue at this particular point of time. At this point of time, you can have the issue, which means that most of the children who have developmental issues, they can identify in the first trimester itself. The doctors can identify. In fact, if I'm not sure if you have watched the movie called what is the name of the movie? Good. I think it's Mimi. The name of the movie is Mimi. When the doctor is telling that your child is there is a tendency of autism, and there then the parents are telling that I don't want this child anymore. So basically, you get to understand that that this is the child developing inside me might have Down syndrome, might have autism, might have anything for that matter. But autism is a little difficult to diagnose within the womb, but Down syndrome definitely you can diagnose. So all of this happens in the first trimester, and that's why mothers are asked to take proper rest with no exertion, no stress, because it impacts and it can lead to developmental issue with which the child might have to survive the entire lifetime. Okay. Now, thing is, for example, the kidney or heart related problems that can happen together at this period, because the kidney and the heart develop simultaneously in a human being. When when the entire human being is being developed, so at that time the kidney and the heart is being developing, it develops together simultaneously basically. So many issues can happen at that particular point of time. Okay. So now I will talk about that. What are the developments that happens between the second, third week, fourth week, fifth week, and sixth week, like this. Okay, so I've just make certain notes which I would refer to now. So during the third week of pregnancy, at that particular point, the organs that develops are the heart, the brain, the spinal cord, and the beginning of the gastrointestinal organs. So at this time, if there are any infections, if there are any bacterial infections or viral infections, that can actually, what can it lead to? It can lead to missing bones in the child, or it can also cause heart outside the chest cavity. Can you imagine heart outside the chest cavity? So that can happen only when there is teratogenic or bacterial infection during the third week. Because third week may you have all the important organs developing: kidney, brain, spinal cord, heart, all of them. Any infection at that particular point of time, the child can have a missing bone, or the heart can be outside the chest cavity. The second one, which is the fourth or the fifth week, at that time, the child develops the vertebrae, they can develop the lower jaw, they develop larynx and rudiments of the eyes. So rudiments of the eyes and ears. So the eyes and ears does not develop all together. Little bit of eyes and ears. So basically it will look like a tadpole. When you do USG, you look like a tadpole, but you will not be able to differentiate between a human child and a toad. But that is how it is. It develops very slowly, and that's why the chances of infections are also pretty high at that particular point of time. You can also see the legs and the feet, but they will be like joined. It is like a paw, it is like joined like this. That's why it is called like a tadpole. Like how you have for frogs, it's joined like this, so it would be like that. And the heart also starts by the end of fourth and fifth week. The heart also starts rhythmic beating. So heart starts beating, and then but it is still outside the body, it is still outside the cavity, so it is not inside the body. The heart has developed, but it is outside the body. The embryo has a tail, the tail at the at the back, and it is difficult to distinguish. That's why it becomes all the more difficult to distinguish whether it's an animal child or a human child. That is one thing. And if you have any kind of bacterial infection at the end of fourth or fifth week as a mother, then it can impact your esophagus, you can vertebrae and eyes. They can also have facial defects, they can also have missing eyes. Many people are born with eyes like this, they don't have a proper eye. It is also because of this teratogenic effect that has happened during the fourth or the fifth week. Okay. Next comes the sixth week. So we are slowly moving towards the half part of the first trimester, because first trimester is of 12 weeks. So end of the sixth week, it marks the development of nose, jaw. It also marks the development of palate, which is like this part, and the development of lung buds. So the lungs does not develop completely, just a small bud like a cotton bud it develops. The heart is now almost fully developed and toes are formed and the tail is slowly receding. Like it's shortening, but the tail is still there. Any kind of bacterial infection at the end of sixth week can affect the heart of the child. Okay. Then comes the seventh week. In the seventh week, the eyes move forward. So right now the eyes were developing, but now the eyes move forward of the socket. The eyelids are formed, the tongue is formed of the child. Then all other essential organs of the body kind of develops, right? So you can understand that the first trimester, why it is so important, because most of the organs are in the developing stage at this point. And then at the last stage, it is the final round that is happening, because of which the first and the last trimester is always considered as the most crucial period of pregnancy. Okay. And during the seventh week, what else happens is any kind of effect, any kind of bacterial impact that can happen at this time, that can impact straight away the lungs or the heart at this point of time. Okay. So by the like this time also the genitals are formed, but you will not be able to identify whether it's a male or a female. It still will take some time. That's why only after the USG of third month or fourth month, then only the doctors can identify ki ladka hai ki ladki hai, right? It is ambiguous. The genitalia is ambiguous. You will not be able to identify whether it's a girl or it's a boy. Okay. Next comes after that the period of the eighth week. The towards like 4 more weeks left for the first trimester. Now the tadpole looking thing starts taking human shape. You start identifying, okay, the person has not conceived a tadpole, the person has actually conceived a human child. So that is understandable. And then the external ears, the initially it was just a bud, now the external ear starts developing, the genitals appear now. The movement through the umbilical cord is well developed, the muscles can contract. So but still the baby is not moving. It is still like developing stage. And any kind of bacterial infection at this stage, it can impact the growth of fingers. It can have stunted fingers, it can have more than 5 fingers like this. Whether Ritik Roshan had this because of that reason, that I am not aware of, but usually it happens because of that. Okay. And the facial features continues to develop for the next 9 to 12 weeks. So by now you have small stuffs that has been developed, that has developed during the in the human form, but from 9th to 12th week, the next 3 weeks, the facial feature starts developing continuously, properly it develops and all of that. Okay. The eyelids are now closed. The tooth buds, the tooth buds, this part starts developing. And now by the end of 12th week, you can clearly identify the genitals of the child. So you can understand whether it's a boy child or a girl child. Okay. Now, this is first trimester. Now what happens, this is about the child. Now what happens inside the mother is, the mother sleep routine gets impacted. The mother starts feeling nauseatic. They start feeling vomiting tendency, morning sickness, all of that together suddenly. And it can make you very uncomfortable in your own body, because you whatever you eat, you might just feel like throwing it up all away. And then you start feeling hungry a little bit more. You can have acid reflux, you can have a lot of things, and that can lead to a lot of stress, anxiety. You might just feel very irritated throughout the period. It can happen. Or you might have anger issues too at that particular point. In fact, I just want to read out this one because this is a recent study that was conducted. So in a recent study which prospectively maintained antidepressant treatment throughout pregnancy, 21 relapsed compared with 44 of the 65 women who discontinued medication. So basically what it says is, the people who had been depressed like during pregnancy, who tends to get depression during pregnancy, They have a, if you are on medication, if you have taken proper precaution during the first and the second and the third trimester, then it's fine. If you have not, if you have tried to kind of repress it and get over through it, the chances of depression relapsing after the baby is born, which is called postpartum depression, is very high. In fact, out of 60 women who were surveyed, it was found that 20 women continued with medication or treatment or any therapy throughout the pregnancy period. Only for those after the delivery they were fine, but those people who did not and who chose not to continue with the treatment, the depression relapsed as postpartum or after a few years as regular depression. So that is one thing, because of the hormonal changes that is happening. So high rates of relapse is there for anxiety, for depression, for stress, for mothers who are not able to maintain their self or maintain their calm nature or do all the practices that is required for a mother to do. Now, for those who are working mothers, the stress level is much higher, and even for non-working mothers too, for that matter. uh, when you have to take care of all household works and everything, and together suddenly this thing has happened and it was unplanned also. So if it's planned, that's another thing. If it's unplanned, then it's an added stress. So and the stress is not only about what is going to happen, how you are going to carry on with it, but it is also about the finances, the extra expenses, the monthly visit to the doctor. Everything adds on to your stress. So at that time, it is very, very important that if you are not able to manage your stress, you should be in touch with it's with some kind of, I won't say medication is required, but some kind of a therapist, some kind of a psychologist, or some kind of a supportive circle who will help you to get through this troublesome period alone. So you can understand that when we go through our monthly cycles, at that time also we feel so stressed out, so angry, so irritated. But this period, that is only for 5 days, but this is for 9 months. And it is easier for people who do not have who have not gone through this situation to comment on this. But a woman's body goes through various changes. It, like, after, even after the birth, the body has gone through a lot of wear and tear, and it is like it becomes very obvious that, especially with the second and third trimester, when your body starts changing, you suddenly start feeling a lot. Either you feel extremely happy about what is happening, or you might have a very mixed feeling that your body is changing, you will not fit into that same clothes. So all of these factors leads to, and suddenly the sexual life comes to a halt for first 3 months. And then some, if you have cooperative family, that's great. If not, that's an added stress. So, and you will not be, after a few months, you will not be able to do all your work alone, because sometimes you need more time, you have to urinate more, you will not be, so a lot of changes happens basically in the body. So chances of getting all these mental health issues is very high. The best part at this particular time is make yourself a priority. That you should do any point of time, but this time especially, there's a life growing inside you. It's not like the regular time. You have to be very, very cautious about the nutrition that you're taking in, because your child's food is through you. Whatever you're eating, your child is also eating or drinking. No smoking, no drinking during this period. Yoga, meditation, a little bit of yoga is extremely good, because it will help you with the later part of your pregnancy. Then meditation, proper rest, listening to music, you know all of that. And of course, educating yourself about the pregnancy rather than reading any articles of the Google. It's not, don't over educate, don't do anything over, but at least have minimum amount of education, so that you can avoid such issues. Because I have seen so many people in the last quarter who have given birth, and after that they feel that their importance is gone, nobody likes them, and that is the starting tipping point of postpartum. So this is very, very, very important. You need to really, really be very careful about what is happening with you. And because if you are depressed, you are actually passing that cortisol to your child too. And your child will have a genetic tendency of being depressed when they grow up. Of course, our child is not born depressed, but there is a tendency to have depression when they grow up. So that is pretty much about it. And just be very aware of what is happening inside you, in your mind. If anything is bothering you, take help. I still have a patient who consulted me when she was not pregnant. She was going through extreme stress and anxiety. Then she was fine, and we stopped the treatment because she was pregnant. And then throughout the pregnancy period, we did not do any session, but she always was in touch with me constantly about the yoga and everything. We did all of that. Then she successfully delivered the child without any postpartum depression, and she's still in touch with me. So being in touch is important, at least with somebody who will understand your situation. Not many people would understand the situation, trust me. People don't even understand period pains. They think that if my mother did not have pain, why would you have pain? I've seen many guys speaking like this. So don't expect everyone to understand your issues, or don't expect every woman to understand your issue. So find out your supportive circle, be with them. This is going to be a very blissful journey of 9 months. You are actually, a miracle is growing inside you. So let the miracle be a miracle and not a disastrous experience for yourself. I have been advised by one of my friends that before planning a pregnancy, we should visit a doctor. Yes, you should. Basically, a certain tests are being done just to check whether the mother or the father has any difficulty which can impact the offspring. That is one thing. Second thing, which is another thing which is important, is when uh, when you are planning for a pregnancy after your marriage. First of all, take some time before you plan for your pregnancy after marriage. The understanding level between you and your partner needs to be there before you bring a third person. I don't believe in the concept which says that, एक बच्चा ले लो सब ठीक हो जाएगा. Actually कुछ ठीक नहीं होता है. It becomes all the more difficult for the couple. And so whenever you're ready, consult the doctor. And for any kind of, if you feel stressed, if you feel anxious, if you feel depressed, or if you feel too uncomfortable, always along with your regular medicines that has been prescribed, always look for alternative signs. Alternative signs like, a little bit of essential oils, a little bit of calming music, a little bit of meditation, which will keep you at a place which will help you through this 9 months. 9 months is almost like 1 year. So it is very, very important to be in touch with professionals and or a supportive circle. Okay. Also, because many people have given birth, that everybody will start sharing their experience. You really need to use a filter to understand which one to take and which one not to take, because their body is different, your body is different, their health issues are different, your health issues are different. So most of the women in our age now have cyst. So the way we will be developing a body is going to be, and we had so much of antibiotics by now in our body, so the way the child will develop is going to be a little different than the way child has developed when we developed in our mother's womb. So listen to the professionals, take proper precaution. We will come back with the second and the third trimester too, but the first trimester is the most crucial because all the important organs are being developed at this point, and by the end of first trimester you can identify the gender of the child. Okay, not that any hospitals tells you, but by the end of the first trimester you can actually identify. All right, so that is pretty much about the first trimester, and we will be back with the second trimester this Friday. That will be a Facebook live, and third trimester will be next week. So we just wanted to complete this entire period because many women or many audiences in our platform are maybe expecting or maybe planning a pregnancy. So it is very important to understand how pregnancy is not only about physiological but also psychologically. It impacts you not only during the period, even after delivery. Thank you everyone. Thank you for your time. I'll see you on Friday on Facebook live on the second trimester. Thank you.